Hi everyone, and thank you for taking the time to watch this video. My name is Saito, and I'm a PhD candidate from the University of Tsukuba in Japan. I recently published Understanding Citizens' Response to Social Activities on Twitter in US metropolises during the COVID-19 recovery phase, using a fine-tuned large language model in Ryuichi Saito and Sho Tsugawa. As we all know, the COVID-19 pandemic has left a lasting mark on the world. By 2024, millions of cases and deaths have been reported. But beyond these hard numbers, it's just as important to understand the emotional impacts because they navigated challenges restrictions on their daily lives. In this study, we explored how people in large US cities felt about these restrictions. We focused on New York City, Los Angeles, and Chicago. Our time frame also concentrated on the transitional phase, from the pandemic peak to the slow recovery in 2022. We wanted to capture how sentiments evolved as people adjusted to a new reality, where COVID-19 was still a concern, but gradually losing its immediate grip. We turned to the social media X to analyze posts from residents of these cities. Over about a year, we collected over 100,000 posts. This represented tens of thousands of unique users. A key aspect of our research was using real data for training data, as well as observation data. We leveraged majority vote from multiple participants to label posts. This ensures accuracy for our large language models. The model achieved about 80% accuracy, allowing us to track sentiment changes. The results were revealing. As the pandemic eased, negative sentiment toward restrictions declined in all cities. The sense of concern and uncertainty began to subside. Besides, keywords related to COVID-19 started being replaced by non-pandemic terms as the situation improved. What's particularly interesting is the correlation between sentiment and actual cases in each city. In New York City, which was hit hardest early on, this correlation was particularly strong. People's sentiment were closely tied to the pandemic's severity in this area. In Los Angeles and Chicago, the relationship was slightly less pronounced, but still significant. Our study is the first attempt to capture social sentiment from a macroscopic perspective. We use large language models fine-tuned with real data. This approach gives insight into COVID-19 and could be applied to other infectious diseases. If you would just need to adjust the keywords, we chose to submit our research to the JMIR Publication because of its reputation as a leading digital health journal with a global audience. Our research on the application of natural language processing also aligns perfectly with JMIR's focus on novel methodologies in healthcare technology. Thank you for your attention, and I hope this research provides you with valuable insights as we continue to reflect on the pandemic's effects on society.